A lot has happened this week in regards to COVID. We want to answer some of your most common questions. So let's bring in Director of Infectious Disease at South Shore Health, Dr. Todd Ellerin. Dr. Ellerin, man, I have whiplash right now.
Hey, Sonia, how are you?
Yeah, I mean, I'm okay. I'm good. So let's start with let's start with the newest in news, right? Your thoughts on the CDC's announcement yesterday.
Look, I wasn't expecting it to come yesterday either, but I do think that, we continue to go in the right direction. And the bottom line is these vaccines are so powerful, and it makes sense since they're decreasing risk of infection, risk of severe disease, hospitalizations, and risk of transmission as well. I think this is very reasonable. How to operationalize this, how to feel comfortable yourself is another factor, and we'll have to work that out. But remember, I think the key to all this, and we have to keep our eye on the prize, is that getting vaccinated is the key.
Yeah, it's interesting. You mentioned transmission, and that's a point that a lot of people are making. Well, how do I know if someone's asymptomatic, or if they've been vaccinated, or if they haven't, or can I be exposed to something potentially, even if I have been vaccinated, if I'm not wearing my mask and indoors with people who are unvaccinated? So what can you tell us about the data with regard to transmission?
Right, the data on transmission it's ongoing, and the things we know is that all of the vaccines reduce the likelihood of you having infection, which means COVID, the virus in the nose. And if you don't have infection there, then you can't transmit. So that's the biggest impact that these vaccines have. But there's also studies, and one of them from the UK, that showed after actually a single dose of a couple of different vaccines, that there was a significant decrease in transmission, even in those who are vaccinated and got the infection. Now remember, that reduction wasn't 100%, it was about 50%. So that's why still, when we look at the New York Yankees right now, right, we know that they were a vaccinated group, and still there seems to be transmission there. So we're not eliminating it, but again, the bottom line to remember is transmission is reduced, and the key is that when you get infected, you tend to either be asymptomatic or have mild disease, and very rarely do people get hospitalized. By the way, one group I do want to point out is the immunocompromised population. They are people, and it's a heterogeneous group, that may not respond as well to the vaccine. We still want them to get them vaccinated, that's key. But taking the mask off right now, if you're significantly immunocompromised, you really want to talk to your provider first before doing that. That hasn't been a group that's been singled out yet, but we'll be hearing more about that in the future.
Who would you put in that category?
Right, so potentially people on high-dose steroids, people who are on chemotherapy because of cancer, people who have had a transplanted organ or a bone marrow transplant, perhaps people with autoimmune diseases on various types of immunomodulators, those type of patients. I think we want to be careful. One other group I want to mention that's very important is patients on rituximab or Rituxan. That's a chemical that we give sometimes to treat lymphoma, type of chemotherapy. We know that Rituxan and COVID-19 are not a good combination together. So that's another group where you really want to think twice before just taking off the mask, especially if you're in crowds.
Yeah, and Dr. Ellerin, I do want to talk about kids too. I mean, this was huge news this week. 12 to 15-year-olds now able to get vaccinated, but I know a lot of parents out there go, well, what about my younger kids? Should they still wear masks? And we've heard yes, but then I've also heard parents say, well, nah, what do you think?
All right, so there's a lot here to unpackage. I think one of the things I want to get out right out there is masking. I think if you are a parent or you're a child and you feel more comfortable masking, I think you should mask. All right, I think we have to have a no judgment on the masking type policy. I want people to feel comfortable with that. Now, with that said, we do know that children, even unvaccinated children, tend to be at much lower risk of complications. And so especially the more people that are vaccinated that can cocoon around an unvaccinated child, I think the better. So, and as soon as that child can become vaccinated, I'm hoping that parents bring their children to get vaccinated as quickly as possible. I believe in it just as much as I believe in vaccinating adults. Remember, kids can get sick from COVID-19. They can get that post-COVID syndrome. You don't want your child to have brain fog or have their hair fall out, fatigue, chest pain, even if it's not a worry about them getting hospitalized. We can prevent that through vaccination.
Yeah, certainly a lot of those children in that category mentioned at the ACIP meeting earlier this week. Dr. Todd Ellerin, thank you so much for your time today. Good to see you. Appreciate it.
Good to see you.
Okay, you guys, well, we know this is a lot of information, so we're trying to make things a little easier for you, streamlining it, so to speak, right? So check out the number on your screen. It's 214-977-6028. All you got to do is text the word vaccine to that number, and we will send you a link with a ton of information directly to your phone. Everything you need to know to get signed up is also there.